Today, we're going to clear up some confusion about two serious heart conditions, cardiac arrest and heart attack. They are often used interchangeably, but they are not the same. Let's dive into the details. First, let's define what each of these terms means. A heart attack, also known as a myocardial infarction, happens when blood flow to a part of the heart is blocked, usually by a blood clot. This blockage prevents oxygen-rich blood from reaching that part of the heart muscle, causing damage. During a heart attack, the affected person is usually conscious and experiencing symptoms like chest pain, shortness of breath, nausea, and sweating. It's a circulatory problem. On the other hand, cardiac arrest is an electrical problem. It occurs when the heart's electrical system malfunctions, causing the heart to suddenly stop beating effectively. In cardiac arrest, the heart stops pumping blood to the brain, lungs, and other organs. This can lead to a person losing consciousness, and not breathing, or having only gasping breaths. Without immediate treatment, cardiac arrest can be fatal within minutes. Now, let's talk about the symptoms and what to look out for. Heart attack symptoms can vary, but common ones include 1. Chest pain or discomfort. This may feel like pressure, squeezing, fullness, or pain. 2. Discomfort in other areas of the upper body, pain or discomfort in one or both arms, the back, neck, jaw, or stomach. 3. Shortness of breath. This can occur with or without chest discomfort. 4. Other signs, cold sweat, nausea, or lightheadedness. Cardiac arrest symptoms are immediate and drastic. They include 1. Sudden collapse. The person may fall or slump over suddenly. 2. No pulse. The heart is not beating. 3. No breathing. The person is not breathing or is only gasping. 4. Loss of consciousness. The person is unresponsive. Both conditions require immediate medical attention, but the responses are different. For a heart attack, call emergency services immediately. The person needs to get to a hospital as quickly as possible. For cardiac arrest, time is critical. Call emergency services and start CPR right away. If an automated external defibrillator, AED, is available, use it as soon as possible. CPR helps keep blood flowing to the brain and other vital organs until professional help arrives. An AED can help restart the heart by delivering a controlled electric shock. Understanding the difference between a heart attack and cardiac arrest can save lives. Quick and appropriate action can make all the difference. Thanks for watching. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more health tips and educational videos. And don't forget to hit the notification bell.